Dr. Humaira Badsha, consultant rheumatologist, board member, and founder of the Middle East Arthritis Foundation. It gives me great pleasure to invite you to World Arthritis Week from the 10th to 15th of October. It's a completely online event. Come and learn from expert rheumatologists, physiotherapists, yoga specialists, and nutritionists about your arthritis.
Hi, I'm Sandria. On behalf of the Middle East Arthritis Foundation, I would like to invite you to register to the World Arthritis Week, which happens from the 10th of October. A lot of doctor-patient discussions, professional speaking on mental and emotional well-being, yoga and Pilates and dance happening. So please go all out, register yourselves, friends and caregivers, and enjoy yourselves.
مرحبا، أنا عبير. أنا كتير متحمسة وأنا عم بستنى الإصدار الجديد من أسبوع مرض التهاب المفاصل العالمي اللي حيكون أونلاين حيبدأ ب10 أكتوبر. جلسات ممتعة ومعلومات قيمة ومفيدة بانتظاركم، لهيك لا تنسوا تسجلوا حالكم وتسجلوا عائلاتكم وأصحابكم. بنشوفكم بجلسات الأونلاين، ديروا بالكم على حالكم.
Hi, I'm Dr. Humaira Badsha. I'm a consultant rheumatologist with 30 years of experience in rheumatology across 3 countries, the United States, UAE, and Singapore. The most common question patients ask us is about diet and how they can exercise and take charge of their arthritis. Hence, I've taken all these years of experience and evidence-based medicine, as well as consulted experts in the field, and we have this book for you, The Wellness Guide to Arthritis. Proceeds from this book go to the Middle East Arthritis Foundation. So I do hope you will read and find this book useful.
Hi, hello, good evening. Welcome to the third day of Arthritis Week. So far, we've with some really interesting talks over the first couple of days, and it's my pleasure to welcome you to the third day. Apologies for the fact that we're a bit late, but I will start by introducing our brilliant speakers for tonight. Most of you know them already. So it's my pleasure first to introduce Dr. Amel. Dr. Amel, she is a consultant rheumatologist with an extensive experience in rheumatology. She has been practicing both in the UK and the UAE. And the next speaker is Dr. Bhavna, who doesn't need any introduction anymore. Thank you. She's a consultant rheumatologist working in King's College Hospital in Dubai. She underwent her training in the UK, and she's going to join us tonight and share her experience with ankylosing spondylitis. Our third physician is Dr. Ahmed AboGamal. He's a professor of rheumatology, and he is an accredited ULR musculoskeletal ultrasound teacher as well. He is an active member in the GRAPPA network, ACR, ULR, and I'm looking forward to hear his experience in dealing with ankylosing spondylitis cases. We have our patients who kindly offered their time tonight to share their experience dealing with this kind of arthritis, and I will let each and every one present themselves. So, Mr. Guy.
Oh, hi, sorry. Hi, my name is G. I am 38 years old, and I am a patient of Dr. Amel Ginawi, and I have ankylosing spondylitis.
Mr. Hassan, if you can help us, can hear us.
Good evening. Yes, good evening, everyone. My name is Hassan. I'm 48 years old. I'm a patient of Dr. Bhavna. Yeah, the first time I heard about ankylosing spondylitis was literally 4 months ago. But I guess I've been living with it for some time, and I'm glad to share my experience with all of you here.
Welcome. Mr. Amr, would you like to introduce yourself?
Hi all, I'm Amr Ozone. I'm 37 years, and I'm a patient of Dr. Ahmed AboGamal as well.
Hello, welcome.
Yeah,
Mr.
okay,
Varun?
Hey, hi. My name is Varun, and I'm 35, patient of Dr. Humaira Badsha.
Hello, good evening. So going back to Mr. Varun, would you like to tell us how your story started?
Oh, wow. Yeah, sure. I mean, it's been a while. It's like going through this whole journey again. It started back in 1998. I've lost count of that part, but I was 13, and usual, it starts with your, the bigger joints, the knee, the hip, extreme pain, and teenage years went in that, and a bit of crutches over time. And the treatment mainly in those days, it was back in, I think, 98 to 2000, I was in Riyadh. So it used to be diclofenac sodium, which was just non-steroidal anti-inflammatory, and sulfasalazine, and also a bit of methotrexate. So they diagnosed it as JRA initially. That I think that usually happens. So it started with that, and over time, I think when I came to Dubai, it got diagnosed as ankylosing spondylitis, and I realized that one of my grandfather's brother also had the same condition for a while, since the 70s, but it was never treated. So it had the traditional AS, I mean, the spondylitis up the back. And finally, after years of just having non-steroidal anti-inflammatories and sulfa, I think I finally made the move, and thanks to Dr. Humaira, when I made a move to Humaira, I can't pronounce the actual medicine name, but then it was, I think, just last year in June that I started. So yeah, I skipped over a lot of details, but I mean, that's the summary of the story. I mean, if anyone has questions, feel free to ask, but yeah.
Hello, assalamu alaikum.
Hi, Ahmed.
Yes, hi, Bhavna. How are
How are
you doing?
you? Good, thanks.
Amel,
So,
Gianna,
السلام عليكم وبركاته.
عمر حبيبي عامر.
خلي القلب يا دكتور.
Right. So I think, Varun, I just have a comment, and obviously you've lived with this condition for a very long time. And what you typically have gone through is a condition called juvenile onset inflammatory arthritis. And at that stage, it's quite undifferentiated in the sense, children develop symptoms of arthritis. And again, lack of awareness, delay in diagnosis typically leads to delay in the treatment onset as well. So, and eventually it can manifest itself as either spondyloarthritis or ankylosing spondylitis. So I think for those of you who are wondering why it started so early, children can develop symptoms very early as well. Although typical age group is, in the teenage, but it can occur at a very young age. I think that's what Varun has, gone through this. Yeah.
And just to note, I think I went through a bilateral hip replacement in 2009 because the hip joints were the primarily that were affected. So it was 5 years on crutches and then hip replacement in 2009. Yeah.
Right.
Proxima, which was recalled, but that's a different story again. It's a long one.
Incredible. Yeah. So I think, maybe we can ask Mr. Hassan to share the experience, because we have Varun, who's had a very, very early onset of symptoms, and, you've had a very long journey, but Mr. Hassan's experience has been something different. So he's only been recently diagnosed, I think about 4 or 5 months ago. So maybe Mr. Hassan, you can just briefly share your symptoms and how you've kind of lived through these symptoms and how was it diagnosed?
No, thank you. Thanks, Dr. Bhavna. I mean, my story, as you rightly said, very different from Varun. I mean, as I mentioned at the outset, 5 or 6 months ago, I had probably never heard the word ankylosing spondylitis. It was the first time when I actually went into your, at your clinic where this was kind of picked up. But I think, as we discussed, I've probably been living with this for at least from the age of 24, 25, because I've had various stages of pain, lower back pain. Some doctors would call it sciatica. I went through a series of MRIs, and as you know, in one case, at least in 2012. Surprisingly, the MRI did specifically bring out, and I've got the MRI in front of me, and I had shown this to you, and you were pretty surprised when I brought this to you a few months ago. There was stuff like Romanes lesions there. There was facet joint partial fusion there. There was comments around potential onset of spondylitis. But surprisingly, whoever had kind of asked me to do the MRI and then reviewed it subsequently did not encourage me to go to the rheumatologist. And I think that's where I kind of probably have suffered. I've lived through it, and I just always thought that I have a desk job. I worked. I've got a desk job, so I felt that it was always because of the fact that I'm sitting and all. That's why the back pain was there. I'd wake up in the morning and it would be painful. You'd kind of, early morning, typically you'd start feeling very stiff and that kind of stuff. But when I really picked it up was in May this year. I had an instance of my left eye suddenly going into, there was an inflammation in the eye. I thought it was just an eye infection. I went to Moorfields, Dr. Avi, and he was fantastic. He looked at it and immediately he said, it's not an infection. It's not COVID. My first question was, is it some sort of COVID or something? He said, no, it's something inside and it's being caused by an inflammation. And he asked me a few questions, and then he directed me to Dr. Bhavna. And, obviously after that, you did some initial tests and then went through the MRI process, and it immediately came out that there was fusion and there was ankylosing spondylitis. So I think that's been my journey. Obviously, since then, I've been through, the medication process, the physiotherapy, with your team, a fantastic team, by the way, in terms of the physio piece with Gianna, with, the help of your team, Alma and Sherry, it's been fantastic. But I'll take a pause and we can continue later on. Yeah.
Sure. So I think that your journey has raised so many points here. First of all, the very fact that it was picked up nearly 8-9 years ago. A radiologist has actually done the MRI scan. The findings were picked up and a diagnosis was clearly mentioned. And the clinician who requested didn't pay much attention or didn't think it was important for you to see a rheumatologist at this stage.
And this is not unusual in most parts of the world. So which is why, if you heard our initial discussion, that one of the things that we as rheumatologists have been working on in the last decade is to raise the awareness for ankylosing spondylitis. It's very different from other forms of arthritis because like Varun, you could see a joint that was swollen, you could see that your knees were swollen, your hip used to hurt, probably other joints were visibly swollen. But in ankylosing spondylitis, typically what happens is at the onset, the symptoms are very vague. It's a back pain, which most people experience at least once in lifetime, and nothing is visible from outside. So unless you actually suspect spondyloarthritis, you won't do the appropriate tests. And even if you do them, you may not be able to pick it up. So I think this is a very important point that we try to make today. So over to Gianna. I think if you want to take over from now. Dr. Gianna?
Yes. First, just to tell the audience, if you have any questions, just pop them in the chat box and we will we'll try and answer as many as we can, either during the session if you have time or at the end of the session.
Okay. I don't know if Amel give us his history and
the next one.
Actually, okay. I haven't started.
Please hear from my patient, please.
So, Mr. Amel, you have the floor.
Okay, thank you. Actually, my story was ankylosing spondylitis. It started when I was in 24 years of my age. During that time, I still remember that it was only a mild pain in my lower back. But to be honest with you, I couldn't understand what's happening during this time. And I just consider my head maybe because I'm tired, and I ignore it totally. But unfortunately, month after month, year after year, the pain started to increase and start to affect my body movement. So I took my decision and I went to the doctor. And I went to orthopedic doctor, and I believe this is a mistake which I have done it. He told me after the exam he has done, he told me that you have a disc in your back, and he gave some advice and some medicine as well. One of this medicine, it was anti-inflammatory medicine, which is cataflam. And seriously, I felt better when I started to have it during this time. Then I believe our life is considered as a station after station. We are passing station after station. One of the station, maybe it will have, for example, a lot of, let me say stress, sadness. Since maybe it will affect on our immunity system. And that's what happened with me in 2015. In 2015, the pain started to be more aggressive, and I start to feel that there's someone pricking my spine, and in the same time, a lot of stiffness in the morning. It was really very bad time for me. After that, I start to think it's impossible to beat this. So I took my decision and I went to a rheumatologist doctor. He started to do some exam, and he diagnosed me in ankylosing spondylitis. And now I'm with Dr. Ahmed AboGamal, following whatever he's advising me.
Okay.
I think Mr. Amer's story is quite it's a classic story.
Yeah, it's a classic story.
Journey.
Yeah.
Always the response to NSAIDs is tricky because most patients with ankylosing responding well to NSAIDs. This is one of the most common causes of delayed diagnosis, actually. Patient getting cataflam or NSAIDs or Voltaren or ibuprofen sometimes, and they get feeling better for a while. So that's the story for delayed diagnosis, actually. This is a character of inflammatory back pain. Okay, so let's move on.
I think we can hear from G. Yeah, G. I think G is also slightly different because it started slightly earlier, and it's again probably the challenge was that there was no joint in symptoms, so it was only the back. And so, G, please could you let us know about your story?
Yeah, I think the one thing I've never actually mentioned to you before, I just thought about listening to all the other stories, and I think the only interesting thing I can add that's slightly different, I was lucky. Very similar to the other stories in my teens and earlier years, that there was always problems with the back. But then in my early 20s, I sort of started noticing some inflammation and pain in my fingers and peripheral joints, and it was weird, right? And at that same time, I had a friend of mine And she was diagnosed also at a young age with rheumatoid arthritis. So it was kind of top of. And so sorry, my microphone just changed. Can you still hear me?
Yeah.
Oh, sorry, my battery just died. So it was top of mind, and she was so young, and she had RA, and I thought, what if this is arthritis? You know what I mean? So in that way, I was kind of lucky to get that clue from my circumstances, and so I didn't really go through the whole 10 years of trying to diagnose it. But I guess it could have been diagnosed a lot earlier if my parents, we kind of thought, oh, low back pain is fine because I'm very tall. So it's part of being tall. If you grow too fast, then, a painful spine is normal, and it's not.
Yeah,
was it interfering with your, because it was in your teens? Yeah. So was it like interfering with your activities, with
Yeah, but again, it didn't make sense why. We didn't really take it that seriously. But what I can remember from my teens, such a long time ago, but was that if I did very strenuous exercise or sports or anything, I loved running. I loved running the 400 meters, for example. I cannot walk the following morning. I am so stiff from that sort of extreme exercise. So that was always the price to pay. It was always weird. But arthritis, no, that was not it wasn't an option.
Yeah. Okay. Okay, thank you. We can move on.
Yeah, I think I would like to just add to what G was mentioning. I think sometimes it's not, you may have seen doctors for back pain or joint pains, and the diagnosis may have been missed. It's not unusual for us to see patients referred by other patients who suffer from the condition. And, oh, by the way, I had a similar symptom, and maybe you should go and check with rheumatologists. And we are seeing quite a lot of patients recommended and referred by other patients. So we are doing a great job in increasing awareness. So patients actually referring other patients. And this is the way, we can increase early diagnosis. We can make sure that people get aware of this condition. Everybody's aware of diabetes. Everyone is aware of asthma. But rheumatic conditions, rheumatological conditions, I think the awareness is still lacking. Unless the joints are visibly inflamed and one cannot miss it. But ankylosing spondylitis is typically a condition which has a delay in diagnosis by an average of 10 years. And this is worldwide, by the way. It's not just in UAE, but worldwide delay in diagnosis is on an average about 10 years. But overall, I think better investigations, better radiological definitions of spondyloarthritis, that gap is decreasing now. So we are able to pick up early diagnosis, and that's how you can prevent progression. And because once there is a progression, once there is ankylosis, it is irreversible. So you need to catch it early and treat it early.
I think the main issue with the ankylosing spondylitis, rightful as Bhavna said, is the lack of awareness, because it presents with back pain, and back pain is very common in population. And if you have back pain, people assume that it's just a muscular pain, you're sitting in not the right position, you picked up something heavy, you did too much exercise in the gym. So this is how it's assumed. It's just a mechanical back pain, and not actually, it could be an inflammation in the back. And I think this is one of the challenges with people not aware of the disease itself. I mean, I think Mr. Hassan said he's never heard of ankylosing spondylitis until he came to see you, Bhavna. And at the same time, as I said, because back pain is a very common occurrence in the general population.
Yeah, we had, I think the COVID pandemic hasn't helped either. I just recently saw a young boy, 19-year-old, and for the entire last 12 months or nearly a year and plus, he was complaining of stiffness, and they attributed it to online learning, because online school, kids are sitting for 6-7 hours. Obviously, they're going to be stiff. Now, this boy had progressive stiffness, and they attributed it to online learning, until a point came where he was just unable to move. And he has done a round of at least 4 or 5 orthopedic surgeons, and then sent to see a neurologist, and they started investigating him for some sort of a congenital muscular, neuromuscular disease. And the neurologist eventually ordered MRI scan of his lumbar spine, and it was coincidentally picked up that he had very active sacroiliitis. And that's how he landed in my clinic. So this is a 19-year-old boy, 12 months of symptoms. And I must say that it's an early diagnosis considering the delay we have. And he's doing very well after starting treatments and physio and sales. So I think COVID and pandemic and working long hours, sitting in one position, it kind of people assume that this is norm.
Yes, I can also have a story this week. I get a very nice referral for the first time since years from orthopedic with patient with back pain. And already patient has typical ankylosing romanes sign, bamboo spine. But the nice story about this patient, he had already a very minor car accident about 9 years back. And he spent 9 years referring the back pain to the car accident. Every time you have back pain, you just go to the orthopedic and get NSAIDs and physiotherapy, and that's until he met the orthopedician in our center. He made an MRI and found the typical active romanes lesion of the ankylosing spondylitis. That's why he referred him to me. So it means that he have ankylosing almost for at least 10 years before the diagnosis. So because the back pain, as Dr. Ahmed said, is very common, so patient already may refer the pain to any other clues rather than inflammatory back pain.
So I see that the most common symptom in all patients was back pain, but I think Mr. Hassan said he had an episode of uveitis, which raised the suspicion of something else than just back pain. Any other patients have experienced any other symptoms apart from back pain?
I think we have Mr. Sid.
The stiffness as well, as we said, stiffness and back pain. And stiffness, we will not be able to move at all, especially at morning, for example, when we will wake up. I used, for example, when I will wake up, I used to keep more than 2 hours just to be able to move. And sometimes it affected my leg, and I was not able to walk more than 10 meters as well.
Yeah, I think two additional points from my side. I mean, one thing which my family would often tell me is that whenever I'm driving, for example, and I need to turn, I would kind of move my entire, rather than being able to move, which I've now improved a lot thanks to the physio sessions. But that was one thing. The neck movement was a bit constrained. And then I think, Dr. Bhavna, you'll remember the ESR level, which has permanently been inflated in pretty high for me. It was always high, but I think when I came to you in May, it was close to 100 or something. So it was quite massively high, right? Yeah. So I think that was the other thing which I thought is a key metrics that people can kind of watch out for.
And I think you, as you mentioned, you've had high ESR on a number of occasions, which has been completely ignored. And I think nobody tried to investigate it. Right. That's good. And Mr. Hassan, do you want to talk about your eye issues? You mentioned about your eye symptoms. So you want to talk about that?
Yeah, I mean,
that was the symptom which took you to the doctor.
That is correct. I mean, that's how I ended up with Dr. Avi, as I mentioned in May, when it became extremely red. So it was just one fine day I woke up and it was quite red. Never happened before. So I was quite worried. I actually thought it was just something that had gone in the eye, or it was an infection or something. It was paining, it was hurting, and there was also, I could sense that the eyesight was kind of becoming a bit less. But anyways, I went across and it was picked up. And that's when Dr. Avi specifically told me that I need to go to a rheumatologist, and that's where he directed me. And to be honest with you, it just didn't make sense. I said, how could the eye be linked into my back pain? Because that was the first question he asked me. And I said, honestly speaking, so then I asked a few people, and they said, yes, there is a linkage. So that was it. And then after that, he recommended certain medication, which I took for a couple of weeks. It kind of went off. I think my eye number dropped a bit, but then surprisingly, it has come back again after a couple of weeks. So that incident did not occur.
Sure. I think I think
I was going to ask Mr. Sid if he wants to share his experience too.
Yeah, sure. I can have a quick, I'm going to make it short. Slightly different experience to everyone else. Yeah, I was diagnosed as a juvenile at the age of 9. Initial symptoms were actually ankle pain and swelling, followed, and it seemed like just an ankle twist was the initial diagnosis. And as I went to being put into a cast, they had the doctor touched my ankle, and he's like, it's extremely warm, which is unnatural. And before we knew it, I had swelling in my right knee, and then I had bilateral swelling of both ankles and knees. And at that point, it was very much evident that there's a rheumatic involvement. There were initial diagnoses of potential tuberculosis of the bone, but within 3 months, I think we've achieved at a GRA diagnosis. And then subsequently was also told, given family history of AS, that that this is most likely to manifest into AS as I grow up. And the disease evolution was very much that. I think I'd like to share another interesting story. My cousin's been diagnosed, I think, within the last 3 months, and she's the same age as myself. And she's battled back pain for all her life. And only recently she actually been diagnosed with AS. And we do have a strong family history. My granddad had AS, my uncle has AS. So we've got a very, very strong family history of AS. But I was quite fortunate that, it took 3 months to get the diagnosis. But yeah, because it's been almost 20 plus years with AS, it's been a bumpy ride.
It's interesting, Sid, that you mentioned your cousin who's just been diagnosed after battling for many years with back pain, in spite the family history, a strong family history. So I thought this would be a clue for if one member of the family would complain of back pain, that they will be investigated.
I think what happens, and especially because she lives in England, it's because it's just simple back pain. You don't, and I think even there's another side to this of having family history. Family does not want to admit that there is AS, right, to another member, right? So it's always, no, don't worry about it. It's just back pain, and you take NSAID, and then you move on with life. And until it gets to a point where you're crippled or where you're really struggling to get out of bed, you actually take notice of it. And it's then you seek treatment and realize, okay, this is actually AS and not just mechanical back pain.
Yeah, but I think the other point also is that, we've seen that it's quite common to have back pain in women, particularly around pregnancies. And, so there is an average delay in diagnosis. There is a significant difference between men and women. Women tend to get diagnosed much later compared to men. I think it's for the same reason. And also one of the myths is that it was, most of the orthopedic doctors used to think that ankylosing spondylitis doesn't affect women, and it has taken a long time for this awareness to come as well, that it can happen in women, not just men. So I think that's the point. So I think coming back to your diagnosis, you were obviously diagnosed very early on, and when you started realizing that you have to be on a medication, what was your reaction, and what was your what did you go through? You were very young, probably still in school, college. So what was going on in your mind? How did you accept it, and how did you cope with this diagnosis? And also the fact that there has to be a medication you may have to take long-term, and the difficulties in administering the drugs.
So I was in primary school when I was diagnosed. Yeah. Well, literally, I think I was in class 3. Still remember being away from school for about 3 months. And I think at that point, you're too young to understand what you've been told and the gravity of your diagnosis, that you're going to live with it. I think you your parents give you some pills and you sort of move on with life. I think it's, I still remember going on school trips, even as a slightly grown-up child, like as a 14, 15-year-old, I would have a box of pills packed into my bags while all the others were having all fun things. My mom would always be like, this is your pill, like you make sure you have your morning pill, your evening pill, and it sort of went on from there. So I think early on didn't appreciate the gravity of the diagnosis. I think it was only when I was about 15, 16 that I realized, okay, this is more than just popping a pill and moving on with life. And then the disease severity also sort of started to kick in more and more. So I think it was at that stage where it sort of sunk in that, okay, I probably have to live with this and be on medication for the rest of my life.
Sure. I think a question to G, is he there still? I can't see him. Yeah, there he is. So, obviously, it's not just popping pills and taking medication. There are a lot of other adjustments you need to do. Can you share your experience of living with this, especially, after the diagnosis, how you had to sort of, change your lifestyle and how you had to cope and adapt to the new diagnosis when you had to, go on medication or even change your lifestyle?
I think despite how amazing biologics are and how far we've come with treating the disease, there's always obviously things that you can do to supplement, like any condition for that matter, any chronic condition. you know, I think it's all about, you know, I don't want to like say the obvious, which is like, oh, there's some exercises and their diets, and I mean, these things can be explored on their own. But I think the thing people need to realize is that you need to understand your body and really listen to it and really try and get in touch with it, and by whatever means, whether that be meditation or just have some self-awareness, because it is different for all of us. We hear anecdotal evidence about red meat isn't good, and then tomatoes and acidic foods, and everybody's got their opinion and their advice, and you get that sort of advice, and you should try these exercises. And so I figured out, for example, swimming really works for me, not just because it's a low impact aerobic exercise, but it's also something that I know I can keep the commitment up because I like it. I enjoy swimming. So it's an achievable goal that I've set for myself. So, and it's about that sort of self-awareness. The same goes with diet, for example. You can't just take any advice. You know, if you really like something, or you experiment. You know, I tried a year on gluten-free. I tried going fully vegetarian. I've tried things, and I've learned through those experiences, even though they might not have cured me completely. But it's important just to, I guess that's the message, is just explore yourself and explore your body and figure out what works for you in terms of diet and exercise and mental health.
So we all know that anti-inflammatories are the first line. Any of the other patients would like to share their experience with the medication they've tried so far?
Like, I need to ask Amel what's his experience, and it was a simple decision to go for treatment or not?
Actually, when I was diagnosed with ankylosing spondylitis, I was super scared when my doctor told me that you're supposed to start biological medicine. And really, it was a hard decision for me. But after that, when I visited Dr. Ahmed AboGamal, he convinced me that it's better for your life, it's better for your kids. And I started the biological medicine. And really, it's super amazing medicine for me. And I have been using this medicine since more than, I believe, 3 or 4 years as well. I'm not gonna say, for example, up to now, there is no pain at all, but it's changed my life. It's totally changed my life. I will feel sometimes there's some pain. I will consulate my doctor, and I will call him. He will give some advice. He will tell me, for example, come to me, and he will shake me, and he will give me some medicine, and I will be fine as well. This is my story with my medicine, and the medicine which I'm using right now, it's Cosentex as well.
Okay.
Biologic medication is probably a scary term. So whenever you tell a patient, you know, anti-inflammatories are not the way, and you need to go for injections, most of them are injections, and they're called biologic medication, and they read online all those crazy side effects, and the list is very long. Obviously, you get scared, but this is why we're here, to try, you know, to reassure you and explain what are the benefits. And of course, we always need to put in balance risks and benefits whenever you try a new medication. And even anti-inflammatories, if you read the leaflets, they have a very long list of potential side effects. So I'm happy that you felt better with Cosentex. Any of the other patients end up having?
Yeah, I can go and explain that I've actually been through the entire spectrum that exists. Right, so I think I'm a case study for AS. So yeah, like everyone said, I started with NSAIDs. Believe it or not, it started in the era of Indosid and Voltron back in the day. At that time, popped that in with a couple of Panadols. Things used to work quite well. Then moved on to the first level of DMARDs with sulfasalazine, 2 grams a day. When that started failing, added methotrexate to the pool. When that started failing, this was when, and this was, I think it was about 14, and biologics were very brand new. This is early 2000s, like, so they were very brand new. And you know, my rheumatologist said, look, we've got something available. It's a game changer. And at that stage in life, it was a no-brainer, because I was just struggling to get out of bed. And took it, and I literally went into the hospital on a wheelchair and came out running, and without an exaggeration. That's how it was. And then that particular biologic started failing, moved on to another one. So these were all anti-TNFs. Had that for multiple years until I developed some side effects. and then onto the interleukin blockers now, and I've been on that. So I've been through an entire spectrum, but I think the world of biologics has, I would say, given me a new lease of life.
Can I see? I mean, this is remarkable, the story of going through all these biologics. I mean, again, this is something that probably some of our patients with us here might have gone through 1 or 2 biologics. I mean, does it affect, or how does it affect you when you start on a drug and then the drug works well for a few months or maybe years, and then it loses its efficacy, and then the doctor says, well, right, okay, this is not working, we need to switch to another medicine. I mean, does this, how do you accept this information? Are you ready to try another treatment? Are you wondering like, well, it seems that there is no hope, or maybe the doctor doesn't know what they are doing? I mean, how do you accept this? I mean, this is for all the panelists with us.
So for me personally, it was quite straightforward when I think the first biologic I went on was infliximab Remicade. When it stopped working, there was etanercept as an option, which I was like, yeah, that's fine. And fortunately, there's always been something else to move on to. I think it's, if you get to the last stage where you realize there's nothing else to move on to, that's I think when the panic and the fear might start. But until recently, I've not had to deal with that. So I've always known there's something else around. And also from my case, I'm quite, I've been involved in, like, you know, in medicine in different ways and forms myself. So I have a very decent understanding of molecules and where we are with drug research. So that has also sort of always kept my spirits up.
Yeah. I think you were looking into it in a very positive way, that, okay, it's like hypertension, for example, if this drug doesn't work, you can always switch to another drug. But you know, the perception might be also in a negative one, that, okay, well, it seems that none of the drugs are going to work with me, or maybe I should not be on this drug, maybe it's not the right diagnosis. I think these thoughts might go through some of the patients if the drug doesn't work first time.
I agree with that. And I think the one thing I would tell everyone is that educate yourself as much as you can, right? I think that's really important, because, and the ultimate lesson I've learned for 20 over the years of AS is trust your doctor, right? They've gone to university, spent X number of years, treated thousands of patients. You might read the internet on Google, you might read, like there's a mention about side effects, you will read anti-TNF causes XYZ side effects, and you will, at different stages, you might experience symptoms, and you will believe that from reading Google. But at the end, the person treating you has seen so many more patients. They've spent so much time studying these things. They have read all the research papers. So take a leap of faith and trust the expert rather than trying to self-diagnose and self-medicate.
Yeah.
Mr. Varun, would you like to share your experience with the medication you received so far?
Oh, wow. It was I mean, one feeling I had was a mixed feeling. The feeling mainly that went through my mind was the fact that I wish I'd started 10 years ago. That was the main. It was I think it was a breath of fresh air, even after having diclofenac working well for 10, 15 years. But Humira, I think within day 2, it might be placebo effect, I think, I don't know, but within day 3, 4, it was, it had started working. And even though the fear of, oh, is this, I'm feeling some side effect, something is going wrong, is that going wrong? I would actually disturb Dr. My Dr. Humira Bacha with all of these weird questions of, what's the probability of, lymphoma or sorry, any kind of cancer? What's the probability after 6 months? What's the probability after 3 months? Do we have papers on that? Do we have data? Because I believe, personally, I believe, like how I think fellow patient said was saying, like there's a lot of, we end up reading a lot, but I trust the doctors at the end of the day. So it's a bit of, it was a good experience. And thankfully, Touchwood Humira is working well. I am keeping in mind that, yes, there are other lines of defense. And then there's a question I'll post later, I think, on the chat, but it'll be about what are all the doctors looking forward to? Which new medication line are we looking forward to? I mean, in my mind, I know there is a JAK inhibitor that's coming out, but other than that, is there anything else that we are looking forward to? Yeah. There's a bit about mental health, but I think I'll cover that in a bit. I would love to hear.
So we all know that medication takes a while until it starts to work. So unlike NSAIDs, when you feel better after half an hour, with biologics, sometimes the story is a bit different. And it might take maybe 2-3 months, sometimes even longer. And you might lose hope and you might think it's not working for you. But I think the key is to trust your physician and to be patient. So is there any other method you have experienced or tried to make you feel better while waiting for the medication to start? I think Mr. G touched a bit the role of exercise and swimming and keeping active because it will improve the stiffness and the pain. How the others have been?
That I could, I mean, there would be a very, very long comment, but to really summarize it, I think G mentioned very well, is that ultimately you try different things and you figure out your timing. And because we've grown up with it in teenage years, the thing is our relationship with pain, or let's say going to the gym, for example, is very different. I believe, especially for me, it's a personal experience. Like the relationship with pain is it's unique for everyone. So swimming helped the biggest factor because it was less painful, quote unquote, and it felt very natural, and it was good. Meditation, for sure, is something that I highly recommended. It's one of the most difficult things to actually do in 10 minutes. Even though the concept is very simple, it's just to sit and observe. Not about clearing your mind at all. That's not meditation. It's just about observing, sitting and observing. And I wish I would continue doing that. But the biggest observation I'd seen was the fact that the kind of depression that happens through high inflammation is very different from someone suffering through major depressive disorder. So that was a very odd observation, where I would fill out the PHQ-9. Everything is high, 9, 9, 9, or 10. Everything is pretty high, except one factor, which is suicidal ideation. And oddly, I was curious about this, and I think with a lot of doctors started speaking that the inflammation-based depression is very different. And finally, there was an answer for that, because I think for 10, 15 years, there was no answer for it. It just felt like something wrong, but I don't know what it was. And then after Humera, I found out that yes, it was the lingering side effect of chronic inflammation, which we may not feel any pain, but it just stays on and it affects the mental health. And that was a very, very good research that I kind of stumbled upon. But yeah, that was a unique observation there.
Of course, when we're in pain, you don't feel like moving. You don't feel like going to the gym. You can't even imagine, trying to be active. But I think in ankylosing spondylitis, physiotherapy and exercise is one of the main branches of treatment. How was your experience with engaging into physiotherapy, if any? Did you find it useful?
Yeah, it was very, very. The only one was like manual physiotherapy, where that helped a lot, and then a few of them to be done at home. But it was just somewhat of the repetitive nature of it felt like it was a personal thing, which I did not continue personally, and it replaced it with swimming. So that's the biggest factor there. But physiotherapy, 100%, it makes a difference in the morning, especially for example, if it's 30 minutes stiffness, and if you just have that 10, the 5 minutes of pain, if you can take it, it does wonders afterwards. So the morning physio, let's say, really helps with the stiffness overall in the day. But it's just that little hurdle that's there. But personally, my relationship with pain is very different. So I would skip my exercise days, which is not recommended. But yeah.
Anyone else would like to share their experience?
I was going to add on to that. Go on, Jay.
You sure?
Okay. Yeah, go for it.
Okay, thanks. Very short. I know what I'm about to say. It must be one of the biggest cliches ever, and we've all heard this before, but I've had an interesting experience. Stress, okay? I know we all know and we acknowledge, but do we really realize? And I have had a very interesting 1.5 years with the pandemic. I've been lucky enough to take a big step back
from my work, which is normally very, very stressful and high pressure, and I'm very passionate about what I do. And I just kind of stopped that completely. And so for the last, I should say, 6-8 months, I've been baking, which I really love doing. I'm baking bread. And so my mindset, I'm home all the, I'm not good to be home all the time. Anyway, what I'm trying to say is, I'm a good case study for somebody that's been taken from a very stressful environment very quickly into almost a completely stress-free. You know, my worries are very small, and I've been very lucky and blessed to have been able to go through this. And I can't tell you the difference in my body that I can feel. I'm not on biologics, and I'm not on treatment at the moment because I'm between jobs and I've taken this time off, but it's just incredible to experience what it's like to just not stress. And now I'm busy interviewing now for new work, and so it's starting to become a little more stressful, and I've had a few family dramas and things, and when the stress sort of happens, depending on how I manage it, it ends up manifesting as pain. And I know it's a cliche, but it is so true. You have to manage your stress.
Yes, it's a very, very nice point, G, actually. Stress in most of rheumatic conditions, even you could have a disease like that, but with big stress, you have a big disease. It's always activating the disease, and always you can feel pain and fatigue regardless of the control of your disease with the current medications.
So I think I would like to ask any of the panelists, maybe to Mr. Hassan, Mr. Amar, living with this condition, and especially when Mr. Hassan, before you knew this diagnosis or before you started the treatment, your relations, as in your relation with your children, family time with your friends, socializing. I mean, this is before you knew what was going on, and after your diagnosis and after you started the treatment, what change it has brought in your experience?
Yeah, I mean, for me, unfortunately, the whole situation was, it started a bit later on, right? So, I mean, maybe 10, 12 years ago that I really started to feel it. But one thing that I'd like to mention is that just generally the experience with the medication, I think everyone's commented on it. I'll also say the same thing. It's been a few months for me. I've seen a marked difference, an immediate noticeable difference. And Dr. Bhavna knows I like playing golf. My bad golf, I'll try to blame it on the fact that I hadn't taken the medication, because immediately after having taken the medication, I just feel the mobility has improved so much, right? The mobility across the board has improved a lot, and that's been quite helpful. I think overall, people around me have been telling me that, you are walking better, you are feeling better. So the whole feedback that I'm getting generally from friends and family is quite positive. So my experience so far has been quite good. But it is, as G's mentioned, as Varun has mentioned, it is a combination of multiple things, right? It's the medication, it's the discipline. I feel the discipline that I've brought into my life after this whole situation is phenomenal, because this is something which I historically did exercise, but it wasn't really structured. But I think now that's one thing that I've really picked up, that I do make it a point. It's early morning, as Varun said, it helps. And even before I go to sleep as well in the evening, and I sleep better. I sleep so much better. It just makes, it doesn't have to be a long extended one. It's those series of exercises that my physiotherapist has recommended, and it just has helped a lot overall. Yeah.
Great. Mr. Amar?
To be honest with you, my story is a little bit different, because for me, there is no change between the previous life before I diagnosed with ankylosing spondylitis and after medication as well. Let me say I'm considering myself as a normal person. I don't have any ankylosing spondylitis, and I ignore it totally from my life. I will live my life as it should be, and I'm going to trust my doctor, and I will take his advice. What I will feel there is a pain, I will take my doctor advice, and that's it. I haven't changed anything, even my diet, everything, it's normal.
That's a very good point. If I can just add to it, I honestly feel much better, because, the point that you were living with something, and then you've now realized that you didn't have to live, right? You have the medical, technology or whatever is available. Why live with that pain when it's available? And I went through that same, thinking, Dr. Bhavna, when we had multiple conversations, and I must give credit to you. You spent hours with me just to try and explain to me why it's okay. But it's just surprising that why we would continue to live with that pain, especially once you know that it's available. So yeah, I agree with Amel.
Yeah, I think we all doctors acknowledge the fact that when somebody is diagnosed for the first time, it can be quite overwhelming. You start from a stage where people who've lived with back pain for a number of years, suddenly you're asked to face this reality that, yes, you have a condition, it is a rheumatic condition, you've got to live with it, you have to manage it, and you have to take a medication. So we're aware of that. And which is why, it's very important that we spend a lot of time explaining and kind of going through step-by-step guide, you can call it. And if you remember, Mr. Hassan, you used to have, or your wife had so many questions. I always used to say that one thing at a time. So today we're going to talk about exercise. Next time, maybe we'll talk about diet. So because it can be quite overwhelming. Lots of information given in one sitting can be quite difficult to sort of absorb. And as all of you agreed that, it's important to have that trust in the medication, trust in your doctor, and more than anything, trust in yourself, and say that I'm going to do it, I'm going to make it, and I will make sure that I overcome this. I think that motivation has to be there. So anyone else want to add anything?
Yeah, I just wanted to add to that and say that, for everyone out there, we're in 2021. Things have evolved. Like I was diagnosed in the late 90s, right? Or sorry, not even late 90s, in the early 90s. But things have evolved from where we were back then to now. I think there's enough treatments available, and I think like someone mentioned, that it's a bit like having any other chronic illness before the medication. If you do the right things, I think you can live an almost normal life with AS as long as you're diagnosed early. So I think there's a lot. Yes, it's a diagnosis that sort of takes you back when you get it. But I think in this day and age, there's so much available that there's a lot to look forward to.
Yeah, and it's evolving. I think there are more and more, treatments to come. So you're absolutely right. How are we doing on time?
We still have a few minutes, so I think just some take-home points is AS is hard to diagnose, right? Because the symptoms are so non-specific and misleading, and you might end up seeing a non-rheumatologist who might not be aware of the characteristics of inflammatory back pain. But I think if you feel it's something wrong with you, if there is a back pain that doesn't go away, or it comes back every time you stop taking your painkillers, go have yourself checked. Okay, ask for help, either a primary care physician, or if you have access to a rheumatologist, that would be ideal. Because early diagnosis obviously makes a huge difference. We all know that once the changes appear in the spine and the mobility is reduced, there's very little the medication that can do to reverse that. So I think this is what we're all emphasizing on our first visits. When we give you the diagnosis, we keep telling you, the sooner you start, the better prognosis you have. And considering most of our AS patients are young patients in their 30s, they have their whole life ahead of them. So the sooner we do something about it, that will give you a chance to live a normal life.
Yeah, one quick question from my side, and this is to the doctors on the panel, is that, and I think someone mentioned this, right? I mean, the medication is expensive, right? It is not a very low-priced kind of treatment, and unless you have a good, strong insurance backing it up, it can be quite punitive from a cost perspective. So, are there, in your opinion, options that are going to come up in the future which would help kind of that, or is it going to continue to be at the same level?
Yeah, I mean, that's a very good question, Mr. Hassan. So what Sid and others have been talking about is the medication they've gone through a number of years compared to you only started about 4 or 5 months ago. So when we initially had biologics, we had very little options. So initially we had 3 biologics, TNF inhibitors, for instance. We had to recycle these drugs. Sometimes people used to fail and then you move on, you take the 3rd one and then come back to the 1st one again. And slowly that whole spectrum is increasing. Now we have what is called as biosimilars, and these have been very cost effective. In fact, what you are getting, I think, is a biosimilar as well. And they are competitively priced. And going forwards, there will be more and more molecules coming in the market. And because of the competition, the price has to come down and it has to be available for most people. So I think the future looks very promising, and there will be more and more biosimilars coming in the market. So I think they will be very competitively priced as well.
Thank you.
Yeah, I think I agree with Bhavna. I mean, it's actually we are in, if I may say, in positive times in terms of the treatment for all the rheumatic diseases we're dealing with. I always say I'm old enough to have been there before the biologic era, and there was not much that we could offer to patients. However, now since the biologic era, we know that we are dealing with these medications that can change the life style of the patient completely, and they can stop the condition completely, and patients are able to live a very good and almost normal life. And I remember for ankylosing spondylitis in my days before biologics, and we probably were advising patients that this is a chronic condition, it's likely that ankylosing is going to happen, and we always advise the patient about the posture so that if ankylosing happens, it's better to be in an upright position. We encourage patients about exercise and healthy lifestyle. Patients would be on NSAIDs for long periods of time. We used to give medication like what we call the disease-modifying antraumatics, but we were not sure whether they were working, and we know now that they were not working. And then the biologic era came, and we had all these fantastic drugs that nowadays, when we speak to patients about the future, is that you're able to live a normal life, you're able to go into retirement just as any other person, you're able to continue to play the golf like Mr. Hassan, G is able to continue to do the baking, and everyone else is able to do their hobbies in a normal way, and they can plan for a normal, if I may say, natural retirement. So the biologics is a great era, and I think we are lucky to some extent that we are living in this time. Yes, the cost of the biologics is a big drawback. Biosimilars are possibly helping in reducing the cost, although they can still be considered costly. But however, hopefully with all the competition, as Bhavna said, slightly that the price will be dropped when the patency license expires as well. We're hoping that there will be a good price drop. And it sounds awful to talk about price when you're talking about medicine and diseases, but unfortunately, this is what we are facing with. So we are very optimistic actually about the future. We're seeing a lot of new molecules coming out. So there is always, even if what we have now is not working, we will always have something in the future. So I think this is what the message I'm saying is that those who suffer with ankylosing spondylitis might not want to worry much about whether we will at one time run out of options. Hopefully, inshallah, no.
Yes.
Okay. Thank you, everybody, for participating and sharing your wonderful stories. I think there were a lot of good messages to send to the people watching us tonight. Again, if there are any questions, I think there is another round of question and answers towards the end of the session tonight. So just feel free to drop them in the chat box. Yes, if everybody's okay, I would like to wrap it up for tonight. And
yeah, I think, Gianna, if we have probably 2 more minutes,
right,
I would ask each of our panelists to probably give one take-home message to audience who's here today, and all the patients and their carers and their family who have joined us. So each one of you can take a turn and just give one message, what you would like to say. So we can start with Mr. Amel.
My advice, it's not, let me say an advice, not a message. Whenever you will, if you have, for example, if you have ankylosing spondylitis, never go to the sleep while you are in sadness, because it will affect your immunity and they will have aggressive pain.
That's a good one.
Yeah, medication is available, use it and live a normal life. No need to stress about it. I think you can absolutely live a normal life.
And Varun?
Yeah, I think one message would be to trust the doctors, trust the science, trust the medicine, and do your own part, which is eat healthy and work out, swim. Yeah, that's the main message. And not to worry about anything. The stress like G said, it's just it's a big yeah, not to stress out.
Good. And G, you want to contribute?
Yeah, I think listen to your body, be in touch with it, and do everything you can to become an expert in this disease. Educate yourself, get as much information as you possibly can, because the smarter you are, you have to live with this. You only see your doctor every once in a while, so become an expert patient.
Great. And last but not the least, I think Sid, always valuable advice. Sid here?
He's not with us.
Oh, he's probably
Don't see him anymore.
Okay.
All right.
Great, Gianna.
Okay, then thank you very much, and enjoy the rest of the session.
Okay, thank you.
Thank you.
Hi, I'm Dr. Bhavna, rheumatologist in Dubai. It gives me a great pleasure to introduce this amazing book, The Wellness Guide to Arthritis, written by Dr. Humaira Badshah. It is simple yet comprehensive. It is scientific and evidence-based. Apart from giving you information on various forms of arthritis, the treatment options, it has very simple illustrations on day-to-day exercises for patients with rheumatic diseases such as rheumatoid arthritis, ankylosing spondylitis, etc. My favorite is on the diet and arthritis. This is one of the common questions asked by all my patients, how they can modify their diet to benefit their arthritis. And this book has it all.
Hello and welcome back. It's my pleasure to introduce Mrs. Srilakshmi Hegde. She's a senior physiotherapist with an interest in treating orthopedics and sports injuries, and she's going to give us a talk on how to manage the pain related to arthritis. Looking forward to your talk.
Thank you so much, and so sorry for the technical glitch. My topic for today is mobility exercises in arthritis. I think we spoke a lot about how exercise helps and all that in the last session. So mobility, I mean, like someone has rightly said, use it or lose it. So mobility is known to decline with age or disease, especially with arthritis. If you don't start early, you will start losing your mobility slowly. So like in the picture, if the mobility of the hip mobility is around 90 degrees, it starts decreasing to 60 and 30 and 15. So it's very important to maintain your mobility and start off as early as possible. Why do we need to exercise? That's the most important question, because it's very difficult for an arthritis patient to get up and to push themselves for any kind of exercise. It's pain in the morning. So but why is it so crucial, and why do we keep stressing on exercises? Because it's a crucial component in any kind of arthritis, be it osteoarthritis or rheumatoid. Some of the ways how we can, how it helps in the symptoms are, it strengthens the muscle, it improves the range of motion of a joint, that is improving flexibility, it helps in increasing energy, so you feel energized in the morning, the pain automatically starts reducing, because as the flexibility improves, pain subsides. Then it helps in reducing stiffness in the joints, especially done in the morning, because what happens is overnight when we, and they always, we suggest a patient to exercise even in the night just before sleeping, because the morning is definitely better when you do that, because after 6 to 8 hours of sleep, the morning, all the joints are quite stiff, especially in RA. In OA, it's different, or in osteoarthritis, it's different because as the day goes, it becomes worse. Morning, they're much better. But in RAs, especially here, because all our patients are mostly rheumatoid ones, here the early morning stiffness is very common. So very important to start exercising in the morning. Improves balance. Balance is again very, very important thing, which I think most commonly it's been overlooked. We don't talk about balance much, but balance is other important factor, especially as we start aging. Balance and coordination also goes low. So like including Tai Chi, yoga, Pilates, these are the ones which helps mainly in balance. Weight control, which is again most important part. We can include aerobic and strengthening both in weight control. So what all types of exercises we usually, we can categorize into mobility exercise, strength training, aerobic exercise, and exercises that again have, like I told you, which helps you in improving balance and coordination. So mobility exercises are basically like you can start, you can early in the morning, a patient can, even you don't need to go to and hit a gym or something, you can start off in right from your bed. Start doing basic exercises like your neck movements, shoulder rolls, your ankle circles, Pilates, Tai Chi, any of the exercises or yoga, whatever it suits the patient. They can start off in the morning. Morning is the best time to start with any exercise. Suppose if your mornings are busy, by the end of the day, make sure at least once in a day you start doing taking one form of exercise. Then comes the strength. I'll go into the details later. So I'll just brief about the different types of exercise we stress upon. Strength training exercises can be carried out using resistance band. Like you can start using any of the resistance band, like a TheraBand. Why I always prefer TheraBand for RA patients, especially because what happens with the dumbbells and weights, it's a constant weight. There is no flexibility. In TheraBand, we can use, it's more flexible. We can use the resistance, like I can tighten it, I can loosen it depending on my, some days there is flare up, some days there is a lot of swelling. I might not be able to use weights. So I would like to do a very light exercise. So depending on patient's condition, you can vary the resistance. So TheraBands and free weights like dumbbells or ankle strap weights, where you can just very easily strap it around your lower part of your leg, and using body weight or machines in the gym if you are a gym person. Then aerobic exercise should be of low impact variety, because we are concentrating more on our patients who are RA patients or any kind of rheumatoid or AS, ankylosing spondylitis patients I would prefer starting off with a low impact variety, so as not to cause any problems for your joints, because some days, like I said, if there is flare up and you're trying to do high intensity exercises, that's only going to get worse. So after that, then the patient doesn't want to get into any kind of exercise because they're scared. The pain has increased after exercising, so they don't want to get back to, so that fear is already there. So it's better to start off with low impact ones. So that's why walking, cycling, swimming, dance, aqua aerobics, these are all very commonly preferred because they are endurance exercise, very good for your heart. It can take care of your cardiac. It can take care of, it's a low impact variety, especially if you're using a bicycle ergometer. Make sure you don't use anything with a low seated one. And especially if you have like hip problems or a bursitis or any kind of hip joint stiffness, make sure you don't use a low seated cycle, and no stooping or bending too much. Make sure it is more of a cycle, like a city bike, which is the seat can be raised and you don't have to bend too much. And other one is and more than treadmill. Now that the weather is getting better here, I think I would prefer patients going out and walking on a proper walking track rather than walking on a treadmill. But of course, yes, patient who can't go out can definitely use the treadmill. And treadmill, again, you can start off with a low grade and then slowly increase the grades, and make sure the inclination as well, make sure it is not very high inclined or a high grade one. And every week the patient can slowly progress depending on their condition. And exercises that improve body awareness. Like I said, body awareness is awareness of your position of the joint. Like in a medical term, we call it as proprioceptive exercises. These are mainly concentrating on your balance, lessen the risk of falling, because the risk of falling is again very common. So it helps you in improving posture, like yoga, Tai Chi, Pilates. All of these exercises help you in improving the posture and promote relaxation. So coming to the first from the ROM exercises, in that I would like stretches. Stretches are again a range of motion exercise. It helps you in reducing stiffness. It keeps your joint flexible, which can make the daily activities very easy for you. Like stretching and strengthening, both are like, we call it as yin and yang of exercise, because what happens when you start strengthening, the one group of muscles goes for, it starts strengthening, the opposite group of muscles goes for tightness. So what happens, everyone, we are so much concentrating on strengthening, the tightness part is mainly overlooked. So you need to stretch. Before you start strengthening, make sure every day you stretch enough, at least every muscle, like 30 seconds hold, thrice you can start doing it. Make sure you stretch your upper body and lower body both, and then you can start with the strengthening. These are basic neck exercises. These are the ones, these exercises, you can use it as, even as like a chair yoga, which we famously always we recommend patients, especially who are on desk jobs, who can't get up from their chair, who sits for long hours, like 6 to 8 hours of sitting. Sometimes they forget to even get up and move around. Such patients, at least start even on the chair, you can start moving your neck completely up and down. Chin tucks, that is for your upper cervical, you can start doing chin tucks. And the stretching of your upper trapezius, you can do a side stretching, you can do a corner, when you're looking at your opposite end of the chair, you can start just a simple stretch every half an hour to 45 minutes. Make sure you stretch. And your upper, that the shoulder blades, they are again the most common muscles which goes for tightness, especially for desk job people and even for others, because even especially for ankylosing spondylosis patients, which the thoracic spine is the most common area which gets affected at the earlier stages. So start stretching. You can keep moving your upper cervical and upper thoracic area. So this is why have I put this picture? It's because this is one area again we usually forget, and many of them I think don't even know that it exists. Like, I mean, it can cause so much of pain. This is for the upper cervical area, that is your just at the skull area, where we call it the muscles are extremely short. They're very short muscles, and in everyday activity when we talk, move, we don't move that part at all. It's mainly our long muscles, that's our neck muscles, which moves. So these are all the short muscles. We call it as the upper cervical joint. So this is one is this chin tuck. When you sit, you can just do chin tuck and retract back. You can keep your hands behind and just do this chin tuck and push your head against your hand. The other most efficient way is to lie down on your back. Keep a small towel under your head like this here, and then try to tuck in your chin and press against the towel. And so this gives you a good stretch, plus it stretches also and it strengthens both. So it can help you in strengthening of the upper neck muscles, and it will help you in stretching both. And again, coming to the fingers and wrists, again, the most common part which gets affected in which we see in all our rheumatoid patients, especially the first ones to go for it is the fingers and wrist. So the minute patient starts, feeling pain or any kind of stiffness, it's better to start early morning. Dip your hand in warm water as soon as you get up. Once the muscles are a little warm and the joints are a little warm, start with all your exercises. You can use your simple, like a smiley ball or like this, or a stress ball. You can do it in different positions. Every muscle can be worked, include your finger, the inner muscles, your wrist. All the muscles can be used with one single ball. We have, of course, we have different shapes of balls. You get this like a small egg ball for the fingers. But if not, nothing, at least in your office, you can start using with the stress ball. Then you can use like a rubber band or like a crunchy, put it across your fingers. You can start working on your finger muscles. And this is your hip flexors. We call it as hip flexors or thigh muscles, the front thigh muscles. Again, commonly we see them going for tightness, and patients who are having groin pain, who needs to stretch their inner muscles. There's not a proper stretching position for inner muscles, but mainly for your hip flexors, that is your upper thigh muscles. Because hip mobility again is commonly affected along with the lumbar spine. So there's also again important stretching position. Yeah. So, yeah. Coming to the ball exercises. The medicine ball can be used for various exercises. We can use it in our clinics. We can use it in, you can just purchase a ball and you can use it in the home. You use it at home. You can use it for your core. You can use it for your upper body, lower, for everything. It's very simple. I think one TheraBand and one proper ball and a few stress, the medicine ball can help you a lot. You can do all these exercises at home without even going anywhere. In all these exercises, the engaging the core is the most important one. These are all Pilates, like Pilates positions where we concentrate more on engaging the core. This is again excellent for ankylosing spondylosis patient. This is again a patient of mine in our clinic with some great view. So this is basically I'm trying to exercise. This is an early AS case, and she practices yoga very religiously every day, and then whatever exercises I tell her, she makes sure she does. And when she came to within, like, if the patient is already active, it's half of the job is done. It's very easy for us to work on those patients because they're active, they understand how exercise helps. Any form of exercise they can do. I mean, you don't have to like concentrate or say that only this particular exercise works, depending on the area which is affected. This is mainly for the lateral muscles, that is your the spinal, lateral spinal, paraspinal muscles. Because usually in AS, it's your the mid thoracic and upper thoracic is affected, so this helps a lot. Even this exercise, it's excellent for AS patients. Yeah, and these are again engaging the core ones. Like you should make sure that your navel touches the floor part. So engaging the core, that learning that itself is like a big task. So once you understand how to engage a core, it's very easy to start exercising on your abdominals. And this is like a knee fallout. Again, in this, we don't hold the position. We just tend to fall the knee out. This is especially for patients who has SI joint stiffness, and where the rotation and abduction is very difficult for a patient. This helps a lot in controlling the pelvis, mainly for the pelvis. And this is again a bridging technique using your TheraBand. So mainly all the exercises what I have concentrated here is because in gym you have a trainer who can guide you. At home, you can do all these exercises can be done at home as well. You don't, I mean, patients who don't want to go to gym and want to train at home, yeah, you need a proper guidance from the physiotherapist who can, and it's mainly a combination of rheumatologist and physiotherapist who can help you in with medication, and the other one can help you with what kind of exercise has to be done, what to do and what not to do. This is for the outer hip muscles, that is hip abductors. In this, we make sure that the leg doesn't fall out. So TheraBand helps in controlling the hip. And this is again, it looks like a simple, like a half sitting position or half squat, but yeah, maintaining this position for like 30 counts or 15 to 30 counts itself will help you with your core muscles, with your quads, hams, all of them. And basic hip mobility exercises, be it any kind of problem. Hip is again forgotten. We don't tend to concentrate more on hip. So all this will help in hip mobility. That is your make sure you keep moving your hip forward, backwards, sidewards. This is for your wall. That is your corner stretches. Again for the middle scapular muscles. that is your shoulder blade muscles. All these are back extensor muscles. Again, for the back extension, that is your back muscles. There are back muscle strengthening, there are abdominal, because both are like, you need to strengthen your back and stomach muscles both. If most of the time your back muscles are over strong and your stomach muscles are very weak, that again leads to back pain. These are all cat and camel exercises. Again, forward and backward pelvic tilts. This is most of the times either the patient has an excessive forward tilt or a backward tilt of the hip, or this works very good for those patients. Yeah, this is again one of our patient who has an earlier ankylosing spondylosis, but again very active, who is majorly into swimming, and she came with like again a severe pain, but swimming and swimming, walking, and everyday regular exercises, especially these shoulder stability exercises and retraction exercises, helped her a lot. Yeah, this is like these exercises. It's just your TheraBand position varies in this, because initially we are concentrating more on your the upper trapezius, middle, and the lower trapezius. So with just one TheraBand, you can concentrate on all the 3 levels. This is again planks and back extension exercises. This is again for your hip mobility. Because I can't go too much into details of every exercise, and the basic ones have covered. Yoga, next, once we are, there are again different, like I was speaking about yoga, Pilates, and Tai Chi. These 3 forms are like yoga because again, it concentrates so much on flexibility. Even one Surya Namaskar will take care of all your muscles for stretching. If you don't have more time, at least a couple of Surya Namaskars is more than enough, I think, in a day for patients who don't have severe flare-ups and who are able to do it. So yoga is again associated with wide range of physical and psychological benefits. Again, meditation, breathing, which helps you in improving your lung expansion and helping you in the stress. It increases your positive feeling and well-being, which is most important. I think no exercises will work if you are stressed out. The minute you're stressed out, all your upper, your middle scapular muscles, all these muscles, they go for stress. So it goes for spasm. So you need to first relax, breathe, and then you can start off with any kind of exercise. Pilates, again, it's gaining a lot of popularity of at least last 5-10 years. We have mat Pilates, we have reformer. So patients who can't do mat, which is more into core strengthening, and they feel very difficult, they can do. Then especially what happens with Pilates or yoga, other problem is your wrist. When there is severe wrist swelling, you tend to put so much weight on the wrist. So you need to be very careful with all those things. So if you have wrist pain, make sure you don't put weight on the wrist and all that. So in such cases, reformer Pilates, which uses mainly machines, it can help. Because in mat Pilates, it's mostly we are stressing on the wrist joints. So of course, you can use instead of putting direct weight onto the mat, you can use a dumbbell or a kettlebell and hold the kettlebell and then do it. We can do a lot of variations in exercise depending on patient's condition. We can change the positions and everything. So there's nothing like a patient has to stop exercising completely. If this
Srilakshmi, I think we only have a minute or so top.
Okay, sorry. Yeah, I'm done.
Thank you.
I'm done. Yeah. Next is water exercises. Again, aquatics, very, very useful. Patients who can't do more of weights or TheraBand, water itself will act as a resistance. So you can start with aqua aerobics. Tai Chi, again, like I said, it's more of the posture itself. It will help you in relaxation. It improves immunity, and they have found a lot of benefits with Tai Chi. You can read about it or Google about it. So each in RA, we have different exercise programs. Like you can do 5 sessions a week, upper and lower body both. You can use like a 45 minutes a day. Include aerobic exercises, walking, cycling, any of them. And we usually say 60 to 80% of your HR max. HR max is like 220 minus age. So we have to calculate, depending on that, we can give them. And Yeah, for osteoarthritis, again, 1 hour session thrice a week, because sometimes excessive exercising and OA also can lead to more stress and strain, can lead to more flare-up. So you can continue with 1 hour, 3 times a week, and then slowly you can progress. Yeah, whatever active, the main caution, I think this is the most important thing, whatever activity you start off gently, and remember that regular exercise is better than overdoing it. So don't overdo it. If you have not exercised at all, just one day, don't get up and start over exercising. Go very slowly, and gradually every week you can increase your resistance. Like in RA, morning stiffness is very common. So start with a warm shower and start exercising early in the morning. In AS, ankylosing spondylosis, concentrate more on your neck, back, shoulders, and hips. These are the first ones to get affected. And breathing, very important in AS, because you need to improve chest expansion, because lungs are again going to get affected in this. So swimming is
I think we all exceeded our time a lot, but thank you very much for your. Yeah, it was really interesting, and thank you very much for the topics you've touched. I think patients learned a lot from your talk. Thanks all the other participants, patients, and physicians that have shared with us their experience tonight, and looking forward to seeing you tomorrow for another session.
Thank you.
Good night. Take care.
I was very happy to read the book published by Dr. Humaira Badsha, The Wellness Guide to Arthritis. I am a patient and was diagnosed with rheumatoid arthritis over 10 years ago. And I was very pleased because the book is not limited to just scientific or the traditional Western medicine approach to arthritis. Of course, it talks about the science and the different types of arthritis and the importance of having proper diagnosis and proper protocol for managing the condition, including medication and assistance by your physician. But the book goes well beyond. It's actually a holistic and integrative approach to the patient.
Let's go.
Hello and welcome back, everyone. Good evening. My name is Joy, and I'm the head of communication and patient engagement in Novartis in Gulf. We're so excited to be here today, especially in this next session, which is a bit different, with the title of Unexpected Friends in Unexpected Places. And we have with us today, of course, as you all know, Dr. Amel Ginawi. Dr. Amel, as you all know, she's a consultant rheumatologist in Mediclinic City Hospital in Dubai. She's an associate clinical professor in Mohammed bin Rashid University of Medicine and Health Science in Dubai. Dr. Ginawi has more than 20 years of experience in rheumatology in the United Kingdom and in Dubai. And she has graduated from the Faculty of Medicine in the University of Khartoum in Sudan. And of course, we have with us our special guest, who I think is a familiar face to all of you here. We have G. G is a 30-year-old creative director from Cape Town in South Africa. He's been calling Dubai home for almost 7 years, and he was diagnosed with ankylosing spondylitis. G is very passionate about talking about arthritis and his experience and supporting patients in such condition. What's special about this next session is we want to see the importance of being an advocate and how to have all of you connect with each other, to support each other and learn from each other to raise further awareness in our region. So with no delay, I will leave the floor to Dr. Amel. Please, Dr. Amel.
Thank you. Thank you very much, Joy, for the kind introduction. And again, welcome, G. And today, yes, this session is going to be slightly different. And we thought we're going to talk about, as the title says, relations in unexpected relations or friendship in unexpected places. And through this discussion, we are in fact advocating the disease, how to live with the disease and how to advocate it among all of us. Now, G, we discussed this and we discussed how we're going to do this session. And we thought about, as you know, you have been living with the ankylosing spondylitis for most of your life, if I might say that. And has it ever crossed your mind to think of the disease as a friend? And can this be happening? I know that, as I said, we're going to look at it from a different perspective today, and we're going to reflect on this. And so that's how I wanted to know. If we ask the question, can we befriend this disease, this chronic disease in general? What do you think of that?
Yeah, so I think we wanted to take this conversation and we thought of something different, take it beyond the medication and the treatment and the diet, and really kind of explore the different kinds of relationships. And the first one, it's an interesting one to get your head around, because you would say, like, how can I make friends with my disease? So making friends with pain. And I guess for me, it's all about shifting your mind from a place of fighting or resistance, and realizing that there's tremendous power in acceptance. So we're taught by society, in our lives, we're taught that disease is the enemy, and that you're supposed to be a hero and be victorious, and I think these sort of things are relevant when it comes to diseases like cancer or a bad virus, an infection. These are things that must be fought off. But ultimately, I think arthritis is part of your body. It's your body behaving badly. So to me, fighting or having that attitude of fighting it's kind of futile. It's a fruitless exercise, because we need to translate these negative thoughts, into positive ones, because we don't need that sort of negativity if we're going to live with something for a very long time or for the rest of our lives.
I mean, I guess it's like living with a partner. I mean, you have good things about, or living with in your family with your brothers and sisters. I mean, they have positive things, they have negative things, but you cannot ignore them. They are still family. They are part of your being. And I guess the same thing. The chronic disease is there. It's not going to go anywhere. And rather than just fighting it,
and it's not necessarily about rolling over and being complacent. And when I say acceptance, I don't mean that's the easy route to take, to just say, well, what will be will be. It's more about accepting that you're stuck with this lifelong responsibility, not really a condition, but and making friends with that, making peace with that. I can kind of compare it to let's say we spoke about some exercises and swimming came up. So let's say you really love swimming, but you know that you're not that good and you're never going to be an Olympic swimmer. Does this mean that you're just going to fight the urge to swim because you love swimming, but you're not going to be the best. No. So you accept that you're not going to be an Olympic swimmer. You're not going to be Michael Phelps. But with that acceptance, you say, well, I'm going to, continue doing it. It's that same sort of acceptance that you have this unpronounceable condition, and you have to be, you have to be careful about taking up an activity or a food or something that triggers this inflammation or this pain. And you're in control of this friendship. I even have a bit of a sense of humor about it. Sometimes, if I'm limping and there's a funny moment, I laugh at it. It's important to have a good relationship.
What about the pain? I mean, how can you define the relationship with pain? I mean, pain is part of of the day-to-day life of someone living with ankylosing spondylitis. Again, the same concept. How can we befriend pain, or how can we work around pain and accept pain as part of the day-to-day life?
It's kind of, I heard the story once about, I think, Winston Churchill. I speak under correction. I think this might be anecdotal and not true, but it's a nice story nonetheless. I think he had depression, and he always spoke of depression being like a black dog in his life, an imaginary black dog. It'll never go away. It'll always be there. Sometimes it's sitting on his chest, and other times it's just there in the corner of the room. And I guess the relationship with pain is the same. It's understanding that even if you are on biologics and you're on good medication, you're taking care of yourself, your pain is gone. Always remember that black dog will always be in the room, And so the choice is, it's not going to go away. I think that's the ultimate message. And so the choice is yours. You make friends with it, meaning you accept that it's around, you try and keep it away from you as much as you can, but your attitude and your point of view is twisted into something positive, because that can only benefit you. And so give it a name. I'm not joking. Give your pain a name if you have to, so that it's this thing that you can associate with, that's a friend, a thing in your life that you have to take care of. Because if you don't accept this reality, even if you are lucky enough that you live a pretty pain-free life, if you don't accept that reality, there's only two options. You either accept it or you don't. And this relationship is going to probably be one of the longest ones you're going to have in your life. You're going to have friends come and go. You're going to have things change, but this is probably one of the things that's not going to change. So is it not better to make sure that is going to be a healthy, good relationship that you have with yourself and with the pain?
Yeah, I think that's a very valid point. I mean, obviously, we would love to hear from the audience, the participants who's asked about whether this sounds like something that they have reflected on, trying to befriend the pain or befriend the disease itself. And again, that brings us to the other relationships and the other friendships that you can create in the life. Example, at work, with your colleagues at work, again, with the family, with your other friends. I mean, how can you allow the fact that you're living with an ankylosing spondylitis be part of this general friendship?
I think what we need to realize is yes, it's difficult for us, but it's also not easy for them. If you take the closest people in your life, like my mother, I think this journey has been as difficult for her, even though she doesn't have the pain. And if she could take it away from me, she would do it like this. And I'm lucky that she's so supportive, but it's my responsibility to make sure that I align her with this positive view that I spoke of earlier, that she understands my philosophy and that she understands the disease. So can you take a loved one or a friend, if appropriate, with you to the doctor? So that, and I've done this, I've taken my mom with me to previous rheumatologists, so that she can ask her own questions and so that she can hear some of the things out of the horse's mouth. And then we speak about it a lot, often. because it's an active thing, and as much as I am learning through my journey, I am making sure, because she's one of the closest people in my life, that she knows. Also, friends and other people. I think it's important for them to understand. Yes, that's obvious, but even more importantly, for you to have empathy towards them, to also understand that it's not easy for them. You can't see this disease, and it often happens fast. So you'll see, you find one moment, and 2 hours later you're a cripple. Because you just suddenly frozen up because you've been sitting still for too long or whatever. So however it manifests, it's difficult for people to understand, and so you should have the empathy to think, what is it like to be so helpless? They can't help you, and they want to help you. So it's important to pay attention to those relationships, because that is your support, your support structure, love, and things like that.
I think this is important, G, because obviously living with the disease, sometimes there are moments of frustration from being with the disease all the time, and at the same time, sometimes there will be frustration because perhaps the beloved ones around you, they're frustrated that they cannot understand, for example, the suffering that someone with living with ankylosing spondylitis might cause, and sometimes the frustration of how can we help, okay, and that might just create an awkward relationship, isn't it? Is that I don't know, for example, how can I help, and at the same time, the patient themselves might think that, okay, well, nobody's helping or nobody's understanding.
You're right. There's frustrations on both sides, and the only thing that I've experienced so far that helps is open, honest dialogue. Everything really is about talking and communicating with each other about how we are experiencing it, for the one party to have empathy for the other. So for the patient, but the person with the condition, if you're in pain, you're going to inevitably be grumpy, and you might snap easily, or you might not take good. Your brother Googled something and he came back with this, and you should try this advice, and you're impatient with that, and try and not do that, and if you are, then just go and apologize. But just hitting back on that the whole time, it's all about empathy. It's having empathy for one another, and having open, honest dialogue about how I experience it and how they experience it.
And I think in the earlier session, I think it was Mr. Amr he commented, I think, on something very valuable. He said, just get on with it. Just take the medicine. If you have the moment, try to get on with it and have this positive attitude. And this is possibly where also we can advocate, if we're advocating about the disease. This is the fact that you have an open mind and be open about the disease, and discuss with others, and possibly let others know exactly about the disease rather than just hiding it inside.
Absolutely. But the thing that came to mind when you spoke about that is almost the opposite as well, where you wallow in it too much. Get on with it, Yes. But also don't talk about it for the sake of, you get these what's the hypochondriacs, people that love talking about it. That's also not healthy, so it's important to the dialogue needs to be healthy. Talking and wallowing about it, and every time you go have a social interaction and you go out, you're telling people like it's some badge of honor. I have this autoimmune disease that nobody can pronounce. That's not cool either. That's not positive. That's not using it in a positive way, or talking about it in a positive way, because it's not making an impact or a change in people's lives. So it's important to keep the conversation positive.
Okay. And the other thing, coming to the friendship or relationship with your doctor, right?
Yeah.
Again, because the doctor is going to be, this is a chronic disease. The doctor will be part of the life of the person living with ankylosing spondylitis. So how can this relationship be with the doctor?
This is actually one of my favorite ones, because I enjoy this one, and I'm quite passionate. I think this one is, all three of these are, we've spoken about the disease and the family and now the doctor. Yeah, I mean, you know how two countries are allies. You know, like you get the United Kingdom and the United States, and they're allies of each other, right? It's the same. You know, you got to make your doctor your ally, and it's all about having an open and honest relationship with your. And I know I've said that about family and yourself and all of that, but with your doctor, I kind of compare it to finding a good hairdresser. You know, when you go through your life, and especially if you're a lady, I believe one of the most important things is finding somebody that understands your hair and cuts your hair and colors your hair beautifully. And when you found that one, you know, then the life is just easy. And it's the same with a rheumatologist or a doctor. You know, some of us are lucky that we find ones that we just get along with. And once you've sorry, something just happened on my computer. Am I still here? Yeah. You know, once you found the one, you know, it's good. And you know, so like I have a checklist, not a checklist, but I have things that I've realized I appreciate in a doctor. I like to have, for example, of many things, I like to have the ability that my doctor is open to me just sending a quick email saying, hey, I saw this, I read this, what do you think of this? Not all the time, of course, I know doctors are busy, but you're okay with that as a doctor, and you and I have a very good relationship, you know? And so you're okay with me sending you a message, and then you get back to me, you know, and you reply within a day or two. And so not everyone has that sort of relationship with their doctor that they can just ping them quickly or, you know, and so that's very important to me because I like that convenience. And if I had a doctor that says to me, no, you can't message, I won't like that. So you also have to be honest with yourself about what you want out of the relationship. What kind of doctor do you prefer? The more stern, cold doctors that are scientific and just stick to the facts, or do you want somebody that you're more comfortable with, that you can sit and have a warm conversation with, and become friends with your doctor? It's important.
And what about the medication? Because you know that again, medication becomes part of life with ankylosing spondylitis. Medication, as we discussed earlier, sometimes the person with ankylosing spondylitis can go through so many different medications. And how can you define the relationship with the medication?
I think it's you, like I said earlier, you know, it is about trusting your doctor and trusting the meds. But like I said earlier as well, also educating yourself and becoming an expert by, you know, reading the right things and asking the right questions. And if you're not comfortable with a certain medication, you heard something, again, this comes back to the doctor-patient relationship, asking these questions and airing these concerns, for example. Overall, your attitude towards it is that it's not so much a relationship as it is an attitude, I think, is that, you know, this stuff is here to help. It's not a perfect science. We have to appreciate that there are, you know, thousands of people all over the world working really hard at you know, crafting these amazing scientific breakthroughs and things, and we got to trust them, but also be patient and understand that after 6 months, I might have a side effect, or this doesn't happen often, of course, but or a new symptom might, for whatever reason, and there might be a reason to change to another one, and to not lose faith and to and not become impatient. You know, it's a whole system, and it's a whole process and a journey that we've got to go through. It's not a one problem, one solution for everything. Unfortunately, you know, that there is this one golden, I can't think of the word right now, but you know, that there's this one solution for everyone that works for everyone.
And also, again, we're still talking about these relations or friendships in unusual places. Work, again, work is, you know, working with and with a disease like ankylosing spondylitis. We know that if, for example, the person with ankylosing spondylitis has a desk job, then sitting for long periods of time, this kind of stiffness, more pain. How can we create an environment in the work and in the relation with work colleagues? How can we make friends out of that, in your opinion?
Yeah, I think making sure you have a healthy work environment. If you can get a sit-stand desk, for example, so that you're able to continue working but stand up when you feel like it. I often, when I know I'm going to have a long sitting day, I like to set a little Pomodoro timer, like a 20-25 minute, and then you just quickly get up and you walk for 5 minutes and you sit back down again. It's not just for your condition or for your pain, but also it's good for the mind. It actually helps with productivity as well. In terms of colleagues, I think just from my experience, it's a tricky one, because sometimes you don't want people at work to know, because you don't want it to be a disadvantage that maybe your bosses might be worried that you're going to take too much sick leave. I'm going through an interview process at the moment, for example, for new work. And so, it's not something I would declare because it doesn't define who I am, but I've wondered about this. Is this something they should be aware of? Because, I think not initially. And if they're the closest people around you, if they're somehow affected by it, if they see that you're in pain today or something's wrong, it's important for the people closest to you to know. But like I said, I don't think you should talk too much about it. The reason should be there should be good reason behind why you talk about it in the workplace, because that's how I feel about it. Because it doesn't define who I am. It has nothing to do with my work. It has nothing to do with how good I am at what I do and how much I love what I do. So why should it be there? Having said that, I have had once in my career, I have had an opportunity where somebody complained about something and the symptoms sounded like, I've had experience with this now for 20 years. This sounds familiar to me. And I think I referred him to you. I would say to him, listen, I don't know, I'm not a doctor, but go see Dr. Amel and check this out. This could be AS. It sounds like it's AS. I can't remember what happened. But so there are relevant times when your experience is relevant and it can be shared. But yeah, I just share it with the people closest to me.
Yeah, okay, that's good. And so again, if we're considering advocating for the disease, I mean, I think what we've been discussing is basically advocating for the disease, the openness, the creating the friendship, trying to work around the disease, and understand that the disease is part of being part of you, and you'll be living with it for a long period of time. What other advice would you think have helped you, G, over the years with with living with ankylosing spondylitis?
I don't know really. I just think that what I say, the biggest lesson is the acceptance and the stopping fighting, first making kind of peace in yourself, understanding it as best you can, accepting that this is a part of you now. It doesn't define who you are, but the better you understand it, the better people around you can understand it, and the positive attitude, stress. I think the positive attitude helps with the stress. Just like everybody else, to also just look after yourself and to be kind to yourself. Don't be hard on yourself. And just don't wallow in it. Don't let it define you. And don't speak about it when you can and when it's needed. But just don't wallow in it too much. It's a small part of you that you can manage at the end of the day.
Yeah. And I think, I think if there is any, I think we might conclude here. I think that was very useful, G. I've been looking after patients with ankylosing spondylitis for many years, and I think it's a great insight to look at or reflect and looking at it from a different perspective. Is that it's not an enemy. It's not. Yes, it's a disease. But it could be like, it's not an enemy, a big enemy, because it's going to be part of your life, and you probably need to, probably the acceptance, if I may say, accepting the disease. But again, accepting the disease, I mean, is this the right word to say, accepting the disease, and or is it just it being passive about it?
No, acceptance brings peace. It's like why I think of it as a friendship is it's like when you have a friend and they betray you and you're angry and you need to forgive them. That forgiveness brings peace. This is almost the same. You kind of have to, it's not forgiveness, but you need to bring that same sentiment that forgiveness brings into your heart. And I don't want to sound like a tree-hugging hippie here, but it's true. You need to find that, because the only thing that I can guarantee you is that it will bring you peace if you accept. And this is because it's true with anything in life. You know, if you have blonde hair, but you've always wanted black hair, yeah, you can color it, but you're never going to really have, you know, there's certain things we just don't have and we have to accept. And there's certain things that we have and we have to accept. And that acceptance brings peace, and it all just, you know, that relationship with yourself and with and this comes from meditation, self-awareness, all of these great things, reading books, listening to podcasts. This brings all of that, and it helps with everything else, with the doctor-patient relationship, with your friends, with work, and it enables you to speak about it. It's easy to talk about something that you know and accept. It's very difficult to talk about something you don't know very well. You know, if I had to ask you to speak about rocket science, for example, or something that you're not passionate about, you don't know anything about, you can't. But so if you are educated and at peace with your condition, it's very easy to talk about and advocate and share and nurture good relationships.
Which I think brings the point of expert patient, as you mentioned before. Be an expert in your condition, know it very well, read about it, but also when you read about it, read about where there is the evidence and the right information, rather than just getting or compiling, if I may say, not the right information.
100%, yeah. At least, you know, thank God that there isn't a lot of fake news out there about different arthritis, RA and AS and all of that, you know, and that we don't have to fight this, like with COVID, for example. There's a lot of fake news and misinformation. At least we don't have that battle to fight. But yeah, it's absolutely important. And, you know, make sure, even advice you got from me tonight, you know, this is my experience, this is my opinion. Think about it. Think about the advice you're given. Do you like it? Do you believe it? Do you want to try it? Not? And then decide for yourself what you know, what works for you and not. Yeah.
Exactly. Well, I think that was very insightful, G. Thank you very much for sharing your reflections with us. As always, it's very, very useful and helpful. I don't know whether there is any comment or from the audience or any questions. I don't think there is any.
There don't seem to be any questions, correct? Yeah.
Good. So I think we will conclude tonight. Thank you very much, Gia, again. As I always enjoy the discussions, and it's really, I think it's very, it opened our minds into looking into chronic diseases in a different perspective. Thank you very much.
Thanks, Doctor. Good to see you.
Thank you. Thanks.
Hi, my name is Devyani, and I have dealt with autoimmune disorders for over a decade now. The Wellness Guide to Arthritis by Dr. Humaira Badshah is not a book on just arthritis, but on a multitude of other autoimmune disorders. And what is really fantastic about this book is that she also details out recipes and a holistic way of actually dealing with these autoimmune disorders. This was a book I wish I had had when I was unwell, because it would have helped treat me faster and better, because information otherwise is only available in silos, and it all comes together in this book. So if you or your family member has an autoimmune disorder, I would highly recommend that you get your hands on this book. It will just make your life a lot simpler in providing you knowledge and ways to fix it and deal with it. Thank you.
Hello, this is Dr. Humaira Badsha, consultant rheumatologist, board member, and founder of the Middle East Arthritis Foundation. It gives me great pleasure to invite you to World Arthritis Week from the 10th to 15th of October. It's a completely online event. Come and learn from expert rheumatologists, physiotherapists, yoga specialists, and nutritionists about your arthritis.
Hi, I'm Sandria. On behalf of the Middle East Arthritis Foundation, I would like to invite you to register to the World Arthritis Week, which happens from the 10th of October. A lot of doctor-patient discussions, professional speaking on mental and emotional well-being, yoga and Pilates and dance happening. So please go all out, register yourselves, friends and caregivers, and enjoy yourselves.
مرحبا، أنا عبير. أنا كتير متحمسة وأنا عم بستنى الإصدار الجديد من أسبوع مرض التهاب المفاصل العالمي اللي حيكون أونلاين وحيبدأ ب 10 أكتوبر. جلسات ممتعة ومعلومات قيمة ومفيدة بانتظاركم. لهيك لا تنسوا تسجلوا حالكم وتسجلوا عائلاتكم وأصحابكم. بنشوفكم بجلسات الأونلاين. ديروا بالكم على حالكم.